OCD has many faces, not just the faces that we see in the media. And most kids have many different OCD themes. As parents, it's important that we learn all these OCD themes and we're able to recognize the symptoms so that we can get to compulsions early and pull the weed out before it grows. I'm on a mission to teach you everything and anything I can about different OCD themes. And today, we're talking about Symmetry OCD. It's one of those that's missed by parents, so stay tuned. That's what's up next. Symmetry OCD is all about balance, but it will look different for different kids. And ironically, Symmetry OCD is one of the most common early onset types of OCD that you'll see in kids. And if OCD runs in your family, kids are more likely to get Symmetry OCD, which I find kind of interesting. And ironically, even though that is the case, it is often one of the most missed types of OCDs in kids. So a lot of you have asked me, hey Natasha, how can my kid have so many different OCD themes? And is the treatment different for them? And I want to quickly answer that most kids will have multiple OCD themes. It's the arms of the same beast. So your child can have issues with contamination and harm OCD and Symmetry OCD, and it's not like they have 3 different disorders. It's all OCD and it's all treated the same exact way. It's just different types of themes. It helps for you to know these themes so that you can watch and catch compulsions early, because that is when you can really help them the most. If you catch those compulsions early, you're more likely to be able to nip it in the bud than if it goes on for years. So that's why knowing your child's OCD themes are so important. So let's talk about Symmetry OCD. In general terms, super general, it is about balance. And so that's going to look different for each kid. It can be balance in their environment, balance on their body, even balance in their head. So I'm going to go over lots of different examples, but OCD can look different in every single kid. So I may not mention how it looks for your child or how it manifests. So for starters, let's start with the body. With Symmetry OCD, some kids feel like they have to even things out. And so if anything happens on one side of their body, sensation-wise, they have to have that happen on the other side. So I'll give you some examples. If I hit my elbow by accident, I'm going to have a desire to hit the other elbow. If I tighten one shoe really tight, I'm going to have to tighten the other shoe really tight. I want to even that sensation out. If I hurt one side, I want to hurt the other side. If one side is, I don't know, I think you get my point. I can go on forever. I do want to say though that sensory processing disorder and Symmetry OCD are often confused. And sometimes people mislabel something as OCD when it's actually just sensory processing. And sometimes it's sensory processing and not OCD. I mean, it goes both ways. So if your child is just overall sensitive and they don't like tags or they want things really tight, but it's not about balance, it's not about both sides feeling exactly perfect, then it's probably more sensory processing. I just want to mention that because I do see a lot of confusion around that, and a lot of therapists mislabel that as well. So now you know about that. Besides the body, a lot of times kids with Symmetry OCD will have to do things twice. So if I open the door with my left hand, I'm going to open it with my right. Sometimes it's in even numbers. If I'm going to do that twice, I'm going to do it 4 times, or I'm going to do it 6 times. I'm going to do it in an even amount of times. And so you may not notice your child grabbing something with one hand and then grabbing it with the other. That's often missed. And in fact, I miss that all the time until I start paying attention. And then I'm like, wow, she does everything with both sides of her body. I notice that she's grabbing this toy and then she's grabbing it again with her other hand. It's super subtle and it's hard to pick up sometimes. So also, sometimes kids will do that with numbers in general terms, because with Symmetry OCD, they want those numbers to be even. And so if a child is, playing with something and you give them a bag of something, they might count it out and make sure that it's even. Or if they're lining things up, they might want to make sure that they're even. Or if they're organizing things, they might split them in half and make them even. So I do see symmetry OCD impacting how they play, how they do their homework. If they hit an odd number, they might have to even it up because they feel uncomfortable. Or if they're told to do something a certain amount of times, they will have to do it one more time to make it balanced or to make it even. Also, sometimes people do this visually. And so I have worked with kids where they have to even out the room. So they will look at all four corners of the room, or they'll look at a table and they'll have to look at every corner of the table. And so they're evening out the table or the room in their mind. It's kind of a mental compulsion. So as you can tell, symmetry OCD can look like a lot of different things. Now, why kids do this really boils down to two different reasons. Some people with OCD have magical thinking. So magical thinking is an irrational, nonsensical thought, and the child knows it's irrational and nonsensical, that says, if I don't do this, something bad's going to happen. Maybe my family's going to die, or I'm going to get sick. Whatever is maybe another OCD theme, if it's contamination, then it's I might get sick, or I might see someone get sick, or I might make someone sick. It depends on their other OCD themes, what they're concerned with. But the irrational thought is, if I don't do this, something bad's going to happen. And so they feel compelled to do these compulsions to keep the world and everyone around them safe. Now, the other type of motivation around symmetry OCD is related to just right OCD. And I do want to talk about that in more detail in another video, because that goes way above and beyond just symmetry OCD. But in symmetry OCD, it just doesn't feel right until they even it out, or until they tighten that other shoe, or until they tap twice on the other side. And so there is just a need to do it, but there's no thought or obsessive thought that goes with it. It's just an itch, an OCD itch. It just doesn't feel right until I do it. And just right OCD extends way beyond just that balancing, and we'll talk about that in another video. So that's a good introduction to symmetry OCD. I will leave links below to other articles and the International OCD Foundation's fact sheet about symmetry OCD. There's a couple of other different fact sheets out there on the web that I will leave below. But how do you help kids who have this? And so exposure response prevention is always the thing that I talk about. It's always very helpful. So if you do not have a therapist, I always say for OCD, you should be having a therapist if you can find one in your area, because it's not something to mess around with. It's an incredibly debilitating disorder, and it is a neurological disorder, and it needs treatment. The earlier you can get your child into treatment, the better, because it's easier to fix when the child has not had zillions of compulsions for years and years and years. So when kids come to me early, I love that, because it's easier to teach them all the coping mechanisms to crush their OCD. If you can't find someone in your area, you can go on to my online class and you can learn some of these techniques yourself and teach them to your kids. It's doable if you put in the time and effort. So one of the things that I do with kids with symmetry OCD is I talk to them about doing the opposite of what symmetry OCD wants. And I talk a lot about this in my class. And so you want to say to your child, if your OCD, and I love naming OCD, so hopefully you've named your OCD on some level, but you'll say, if your OCD, or if Bob, or if Mr. Bossy, or your dictator, whatever you call it, wants you to do things 4 times, then you say, you know what, OCD, you're not the boss of me, I'm going to do it 5. Or I tell kids, if you knock your elbow and you find that you evened it out, then uneven it by knocking the elbow on the other side again. So in simplistic terms, it's doing the opposite, or it's poking at the OCD. And you want to encourage your child to do that. Unfortunately, this is their battle, not yours, and I always say that. And so they have to have their own motivation. And that's why it's important to get a therapist or do my class and learn, how do you motivate your child? The first step is educating them on what OCD is. And I made a video to show kids, hey, this is what OCD is, so they understand why it's important to not give in to their compulsions. A lot of kids will say to me, Natasha, this symmetry OCD, it's not hurting anybody, so what's the big deal? Who cares if I open up a door with my left hand and then the right? Or if I tap the top of the door twice or 4 times when I walk through it. I mean, that's not hurting anybody. Yeah, it's not. But I have watched people get incredibly debilitated by symmetry OCD because they can't function, because they're constantly having to even things out and they can't move on. It's a distraction, and it can actually slow people down to the point where they can't function. So anytime you are riding down that neural highway, it's what I call it. So OCD is a bunch of neural pathways that are getting reinforced every time your child does the compulsion. And I explain this to kids. I say, every time you do a compulsion, you are riding down that neural highway and you're making it a stronger highway so that OCD can ride down it a lot quicker. You don't want to do that. You want to break it up. So educate your child, have them watch my video on what is OCD, and get with a professional or learn things online and teach them how to fight back. In the next few weeks, we'll be talking about different types of OCD themes, and you can hit subscribe so you don't miss them. If you are not in my private Facebook group, you should be over there at facebook.com/groups/AT Parenting Anxious Kids. If you want, you can visit me on my website. I just changed the name of my website and I'm so excited. It's anxioustoddlerstoteens.com, encompassing all ages. And if you are wanting a little bit more of me, listen to my podcast, the AT Parenting Survival Podcast. You can find that on iTunes and wherever you get your podcasts. If you're liking my videos, don't forget to give it a thumbs up. That's super appreciated. And don't forget to subscribe, because I will be coming out with new videos every Thursday and you don't want to miss it. If you're like, too much information, then subscribe to my newsletter and you'll get it on a weekly basis. I hope you're having a great day. I hope you find the sparkle in everything you do, and I'll talk to you next week. Take care.
One, two, three.
Having a child with OCD is not only difficult and devastating for the child, but it takes its toll on the entire family. Watching your child do behaviors that don't make sense to anybody, and not even to your child, can be completely heartbreaking. And most parents don't know what to do or what their role is in how to help. OCD is a really complicated issue, and even a lot of therapists don't understand how to treat OCD. And so as a parent, you might be lost as to where to find support or what you're supposed to do in order to help your child crush their OCD. To make matters worse, many kids hide their OCD from their parents, so their parents don't even realize the extent of the issue.
I know my behavior doesn't make any sense. It's embarrassing. I don't want my parents to know. My parents don't even know half of the rituals I have to do.
Being in the dark is the worst thing for your child's OCD. No parent has to sit idly by, clueless about how OCD works and how they can actually help their child, because OCD is very treatable, and most of the approaches can be done very easily in your own home. I created the online class, Parenting a Child with OCD, to help you understand your child and understand OCD, but more importantly, to give you the tools to actually help your child beat OCD at home. You can take the online class at your own pace. Every lesson is there for you the minute you enroll, and you can go through it as fast or slowly as you want to. You can also view the lessons on any device, so you can watch it on a tablet, on the computer, or even on the go on your phone. And every lesson is short and simplistic, so that you don't miss any concept or idea. Not only do you learn exactly how to implement cognitive behavioral therapy and exposure response prevention techniques at home, but you are given 23 handouts and worksheets that you can do with your child to implement the things that I teach you in this class. The class comes with 39 lessons that cover every aspect of OCD, from the origins of OCD to what themes to look for within your child, how to talk to your child about their OCD, how to talk to their siblings about OCD, and most importantly, exactly how to carry out exercises and challenges that will crush your child's OCD at home. OCD only gets worse as time goes by. Don't waste any more time. You can do things to help your child right away. Take the class, learn the lessons, and implement strategies and challenges at home and start seeing some improvement right away. You know your child the best. You see them struggling. You don't have to feel hopeless anymore. There are skills you can teach them. Let me show you how. You can enroll today at anxioustoddlers.teachable.com.